Discussing Infrastructure Deficit and Impact on Mental Health in Zambia by Kapumpe Chilufya. Aim: this book attempts to examine the critical role that physical health infrastructure and associated facilities play in the delivery of effective integrated primary health care services to mental patients in Zambia. The working definition for physical infrastructure in the entire book relates to wider capacities that facilitate effective operations of a health facility in the form of hospital buildings, bed spaces, medical equipment, and professional healthcare personnel, among other related elements. Background: the interrogation of the political commitment and unavailability of robust infrastructure development in the context of Zambia's integrated health care system forms the nucleus of the argument in this discourse. Methodology: the arguments presented here are derived from both quantitative and qualitative data pulled from various sources to map out the debate around the impact of inadequate infrastructure facilities on mental health patients in Zambia's health system. Findings: inadequate health infrastructure facilities have had a negative impact on the well-being of mental health patients and other sectors of the Zambian society. Without undermining the existing government's efforts to establish the facilities around the country, Zambia has only one and yet ill-resourced main hospital offering mental health services. This hospital has been overwhelmed by a combination of insufficient infrastructure, as understood in holistic terms, and the effects of the COVID-19 pandemic. The argument is that a system that does not include these elements does not represent the demographics of the country and their variegated social problems. If mental patients do not adequately and freely access the services that they deserve, they are gripped with a sense of marginalization by the Ministry of Health and its cooperating partners. Unique contributions to theory, practice, and policy. For the health reforms to be effective in Zambia, it is recommended that a conceptual integrated health system be anchored on the universal allocation of adequate resources and operationalization of mental health policies. This will enable us to genuinely connect with social determinants of mental health issues within communities. Also, the involvement of non-governmental organizations, NGOs, in providing an interface between communities and governments should be supported by organizational or multi-institution capacity and coordination. A systems theory has informed the framework under which this book systematically advocates for a robust infrastructure development program for mental health care services. Thank you for watching this video. Please subscribe our channel for watch more scientific research videos.